Every day, thousands of people suffer medical emergencies as a result of accidents or illness. Most require some kind of immediate help. You may witness an incident or arrive after the incident occurs, and you may not always know what is wrong with the person who needs care. Finding an unconscious person can be a frightening experience, but with the proper training, you can help replace fear with positive action. Hello, I'm Ryan Sands.
And I'm Connie Harvey. Along with your classroom instructor, we're here to show you the skills you'll need to provide immediate care for a person who is experiencing a medical emergency.
You're already familiar with the emergency action steps: check, call, care. In this lesson, we'll be practicing how to check an unconscious person for life-threatening conditions. You'll learn how to check the scene for safety, how to check for consciousness, how to make the call for help, how to roll a person into a face-up position, how to open an airway, when to give rescue breaths, how to check for signs of life, and how to place someone in a recovery position. Depending on the circumstances in which you find the person, you may need to use just a few or all of these techniques. Watch as Connie demonstrates the steps you should take when you find a person who appears to be unconscious. Connie, I'll give you a countdown. 3, 2, 1, go. Check the scene for safety. Check the person.
Are you okay? Are you okay?
Call for help.
Call 911. He's unconscious.
If the person is face down, roll him onto his back. Open the airway, look, listen, and feel for signs of life for no more than 10 seconds. 1 1000, 2 1000, 3 1000, 4 1000, 5 1000, 6 1000, 7 1000, 8 1000, 9 1000, 10 1000. There are no signs of life. Give 2 rescue breaths.
Breath, breath.
Quickly scan the body for severe bleeding as you get into position to begin CPR. That's your check. You will learn how to give CPR in another lesson. Okay, now let's talk about the airway, the A in ABCs, airway, breathing, and circulation. Learning how to open an airway is vital because if the airway is blocked, the person can't breathe. The airway is the path that air travels to get from the nose and mouth into the lungs. When an unconscious person is on his or her back, the tongue relaxes and falls back into the throat. This can block the airway. Tilting the head back and lifting the chin pulls the tongue away from the back of the throat and opens the airway. Now it's time for you to get into your positions as responder and unconscious person. The unconscious person should lie face down. Responders, you can stand up and take a few steps away from your partner so you can imagine that you are seeing the scene for the first time. Practice along with Connie as she goes through each step. Remember to check the ABCs: airway, breathing, and circulation. The goal is for the whole check to take about 30 seconds. I'll talk you through the steps as we go. If you need a hint, watch Connie or ask your classroom instructor. Ready, Connie?
Ready, Ryan.
3, 2, 1, go. Check the scene for safety. The scene is safe. Check for consciousness.
Are you okay? Are you okay?
There is no response. Have someone call 911.
Call 911. He's unconscious.
If the person is face down, you'll need to roll him onto his back. Position yourself so you are facing the back of the person's head. Go ahead and do it along with Connie. Move the arm that is closest to you up next to the head. Place one of your hands at the back of the neck and your other on the hip, like this. Got it? Gently roll the person toward you, keeping the head, neck, and back in a straight line. Once the person is on his back, you need to open the airway. Try opening the airway with Connie. To open the airway, place the edge of the palm of one hand on the forehead and 2 fingers on the bony part of the chin. Carefully tilt the head back as you lift up on the chin. The airway should now be open. Now, hold the airway open while your classroom instructor checks to be sure everyone is in the correct position. Once you open the airway, you must ensure that the airway stays open by keeping the head tilted back and the chin lifted. Lean down and put your ear close to the person's mouth and nose and check for signs of life. Look at the chest to see if it is clearly rising and falling. Look, listen, and feel for movement and normal breathing for no more than 10 seconds. 1 1,000, 2 1,000, 3 1,000, 4 1,000, 5 1,000, 6 1,000, 7 1,000, 8 1,000, 9 1,000, 10 1,000.
Breaths that are irregular, gasping, or shallow do not provide enough oxygen to the body. They should not be confused with effective breathing. If a person is not breathing, he needs oxygen right away. Rescue breaths are one way to get oxygen into the person's lungs. Don't practice this right now, but this is what rescue breaths look like. You'll learn to give rescue breaths later when we can practice on mannequins. Until then, we'll simply lift our faces forward away from our partners and say the word breath each time you're supposed to give a breath, like this. Breath, breath. Each breath should last about 1 second and make the chest clearly rise. You should pause between each breath just long enough to take a normal breath before you give the next breath. Now, let's all try that together. We'll open the airway, check for signs of life, and simulate giving 2 rescue breaths. Remember, do not blow on or near your partner's face or pinch the nose shut. We'll practice this later on a mannequin. I'll give you a countdown. Ready? 3, 2, 1, go.
1 1,000, 2 1,000, 3 1,000, 4 1,000, 5 1,000, 6 1,000, 7 1,000, 8 1,000, 9 1,000, 10 1,000.
Breath, breath.
After you check for signs of life, quickly scan the entire body to make sure there is no severe bleeding as you continue. That's it, the whole check. With the information you've gathered during your check, consciousness, airway, breathing, and circulation, you'll be able to determine what kind of care the person needs. If at any time you notice an obvious sign of life, keep the person's airway open and monitor the ABCs. Later lessons will describe what kind of care you'll give in each situation. That will be more about the care step in check, call, care. Step away from your partner one more time. We're going to go through the whole check again, but this time we're going to pretend it's real and it will happen much faster. I won't tell you what to do. I'll only tell you when to start and what conditions you'll find as we go. The goal is for the whole check to take about 30 seconds. Okay, everyone, you've just walked into a room and discovered a person who appears to be unconscious. Here's your countdown. Ready? 3, 2, 1, go. The scene is safe.
Are you okay? Are you okay?
The person does not respond.
Call 911. He's unconscious.
One 1,000, 2 1,000, 3 1,000, 4 1,000, 5 1,000, 6 1,000, 7 1,000, 8 1,000, 9 1,000, 10 1,000.
There are no signs of life.
Breath, breath.
Time's up. Now you're ready to give care. Another thing we want you to learn is a recovery position. A recovery position is used when a person is unconscious and breathing normally, or if you are alone and you need to leave the scene to call 911.
We'll practice rolling the person away from us. You can do it along with me. If you're not already there, kneel at the person's side so you can support the body at the shoulder and at the hip. Take the arm farthest from you and move it up next to the head like this. Take the other arm and cross it over the chest. Then bend the leg closest to you up like this. Supporting the shoulder and hip, gently roll the person away from you without twisting the body. Be careful to support the head so that it angles toward the ground. This will allow fluids to drain away from the throat. Now your partner is in a recovery position.
If you suspect an injury to the head, neck, or back, and you cannot maintain an open airway, or you need to leave the scene to call for help, you can modify a recovery position like this. The head, neck, and back should be aligned. The lower arm extends out, and the upper arm rests on top of the body. Both legs should be bent at the knee. One more thing you should know. If the unconscious person you are caring for vomits, the airway could become blocked. Quickly remove any breathing barriers and roll the person onto his side. Use your index finger to clear out the mouth, then recheck for signs of life before moving on.
Okay, everyone can sit up and relax for a moment now. You've just learned how to check an unconscious person. Remember, check, call, care, the key to effective emergency response. And don't forget about the ABCs. By understanding these first crucial steps, you're well on your way to knowing what to do in a medical emergency.
Be sure to ask your instructor if you have any questions about what you've seen here. Make sure you're comfortable with the information and the skills before you move on to the next lesson.
We'll be back soon to begin showing you how to care for the different conditions you might find.